Good day to the students of the NCM 110 Nursing Informatics lecture. Our topic for this afternoon is related to the hospital information systems. I know for a fact that the NCM 110 team in the laboratory aspect of the NCM 110 have already conducted a webinar for you to appreciate about hospital information system using the platform Bitsbox. And this was shared to us by the our information officer from the MCU FDTMF Hospital. Our topic had been integrated in the nursing informatics lecture simply because to broaden the specific details of the bits box and some of the specific components that have not been presented during the webinar in NCM 110 laboratory. And hospital information system are significantly very important now simply because of our situations of public health emergency, which it caused some restrictions, limitations based from the implementation of the minimum health protocols in most of the hospitals and other healthcare facilities. I will be presenting to you a video about the bits box. It is very important for us to consider of what is e-health and how this is somehow related in the implementation of the hospital information system. Let us take into consideration on how the healthcare delivery system is now different when it comes to the integration of nursing informatics in the healthcare delivery system of our facilities. The use of e-health has, uh, in particular, set standards on how the data will be protected accordingly through the use of the internet and the social media. It comprised the e-health. Actually, we have also integrated some of its aspects from the mobile health. The direction of having the e-health is for better healthcare and healthier life. Sharing information could be accessible. Digitalization of records, it will reduce paperwork. It may not totally disregard paperwork, but however, this serve as the convenience and is accessibility. Treatments can be done on a remote, tele conference, or through the use of the telehealth. Since it sets the restrictions of the face-to-face consultation, we have many ways of using the hospital information system to still achieve security and will enable our professionals to as well consider the point of setting records to be protected whenever they are needed within the hospital operations or either outside the hospital. A typical example is this clinical portal wherein it unites the data accordingly, the use of the advances in technology, even the client had been discharged or if the client had been catered accordingly as outpatient department. The continuity of care is through the access of some of the applications that have been covered of the hospital information system. There could be video consultations or teleconference, monitoring of the client's condition, and easy access to medical professionals and even nurses for assistance. That is now the evolution on the use of the technology, enabling the people to maximize the resources and provide information that may have security features, enabling conversation using the teleconferences. It's time friendly. It may provide various e-health tools that may consider flexibility in spite of our busy schedule, which is somehow very relevant now when it comes to our concern with the public health emergency. Using My Health Online is another platform by which it considers the access of the health team on the electronic health records, which is a revolution when it comes to healthcare. Because in any place, it could improve the accessibility of the health records. And this could be possible through the use of this platform. Collaborative efforts among the health team members are also being considered because the health team can still consider holistic approach towards the treatment of the client. As they develop the technology, hospital information system, and the e-health could be very beneficial to the stakeholders, to the organization, and the hospital. How about the Beats box? So as had been shown in the video presentation of the Bits box, the if ever the audio or rather the sound of the video is not audible, so I may have a separate post to access the video for a clear audio for your reference. So talking about the hospital information system, so you have witnessed in the video presentation of the various features of the hospital information system. And it may not just only cover one area of its operation, but the totality of the organizational operations are being covered as well, from the admission to the financial management to patient care management to until to the operation of the outpatient department when the client had been discharged, and inventories of supplies, stocks, and equipment. Hospital information system aims to consider the administrative and the clinical operations. If we say administrative, these are the decisions that may significantly pertains to the processing of, for example, health contributions of the client, processing of the billing statement of the client, access of the top level management to the operations of the hospital, decisions that are significant with the inventory of the supplies, decisions that are very crucial with the middle managers in coordination with the frontline uh, employees. It is on how the communication serve to synchronize the operations and decision making as well. It optimizes also the process on the clinical operations. If we say clinical operations, we now involve the healthcare team, wherein when the client has had been admitted in the hospital and served, attended in the emergency room, the data that are being processed from the time of interview, from his medical history, previous hospitalizations, if hospitalized in the same hospital, or even in other hospitals, these are the sources and references so that we are aligned with the appropriate treatment of the client. A typical example is the tracking of the history of the client when it comes to allergic reactions to drugs, to food, or any solutions that have been administered to him or to her. And through this access of the information, the time are being managed efficiently because it may not require interview. Although when it comes to the validation, it is still need there is still need to ask the client when it comes to the information that had been collected and retrieved from the electronic health records. It is designed to store and manage hospital information system when it comes to medical care, lower cost, and increased efficiency. Store and manage hospital information require resources and efficiency, as being emphasized in our previous discussions, are related to maximization of resources. In the implementation of hospital information system, it may not just only need computers. We may need also manpower. We may need machines. We may need money for budget allocation. We may need also manpower experts, IT specialists, a department who monitors the operations. So On this level, hospital information system will be very beneficial individually, to the department, and even to the whole organization. Thus, we have the what we call HITP. The HITP is the Health Information Technology Provider, which covers the PhilHealth online verification of eligibility. The HITP is being used in most of our hospitals, regardless of the platform, to validate the eligibility. That's letter uh, eligibility. Eligibility or eligible. So let's correct the spelling. Eligibility of the client when it comes to the access of information of his or her status on the PhilHealth contribution. And the PhilHealth online verification of eligibility is to validate both S claims and electronic claims. The S claims had been submitted as on the physical contribution, and the electronic claims had been transferred through the online, which is part of the submission system of the PhilHealth. So we have the health information technology provider and covers verification of eligibility. The health information technology provider considers the a very friendly system that reduce the processing time. To what extent? The client may not anymore verify physically and proceed to the PhilHealth offices and agencies just to verify the contributions and e-claims of the client, which are being processed by the relative. The hospital can verify through the use of this health information technology provider for a faster and efficient remittances and access the health facility. This could be processed also by the hospital themselves if the platform is compatible also with their accessibility and given rights also by the PhilHealth agencies to have the remittance effective and efficient. It saved a long queue when the client's relative proceeds to the facility or to their offices. So the claiming of the PhilHealth benefits could be much faster and it could be transferred accordingly by the hospital, which will not require anymore the client's relative to process it physically to their offices. So this it reduces, it's a faster remittance and saving the long process of claiming. Now, this is the online application entry, the HITP, wherein some of the most of the hospitals have PhilHealth representatives for the customer assistance as well as on the processing of the PhilHealth through the use of the HITP, the Health Information Technology Provider. The one that is projecting in our slide is the online application entry on how to process data and translate it into information once entered into the online application entry. It has also security features. It can validate your e-claims and it could access the uh, tracking of the details pertaining to the PhilHealth contribution. Let us now proceed of what is SMS notification for doctors. If we say SMS, it's short messaging system. So when with these features of the VITS box in the hospital information system, there's SMS notification for doctors. So the doctors will receive a text message containing the patient's profile. If ever the doctor is not physically present in the hospital and the doctor is assigned to manage the client upon the admission in the emergency room, the doctor will initially and primarily received through text message the patient's profile, including name in the initial diagnosis before the actual encounter, giving the doctor a quick preview of the patient's concern, specifically access on of the pertinent information of answering the what, the where, the when, and how it happened. If the patient wants to cancel the appointment, the doctor will notify through SMS. So this is very applicable when it comes to inpatient and outpatient. For inpatient, when the client had been admitted in the emergency room, the nursing personnel or assigned personnel will process the information so that to have this access by the assigned doctor. The SMS notification for doctors are also applicable when the client wish to set an appointment, okay, wish to set an appointment with his clinic, and while the doctor is not yet in the clinic, the doctor will receive specifically the uh, information of the patient's condition, even he's not yet attending to the client. And through the short messaging system, there are many platforms, even at present, that may consider this. The basic difference is that of these platforms can be embedded to the hospital information system, which is called as SMS notification for doctors. This is a feature of the SMS notification for doctors, wherein there will be an entry of the inpatient registration form by someone, the nursing personnel, who is assigned to enter the data and translate it into information. And once the information has been processed, the attending physician will receive this information, which includes from what hospital, the name of the client, the age, the gender, the client's room where the client had been admitted, time, and chip complaints. So in this consideration, the doctor may have the convenience to communicate most specifically when the situations goes of an emergency situation. It could be managed by the attending doctor who is in the hospital, uh, may implement such treatment regimen even still even the doctor is still not in the hospital vicinity. Now, we have the balance detection for patients with unsettled accounts. This have been during my hospital practice. This have been also one of the source of uh, inconveniences of the clients and even the client's relative of a long queue in the accounting department just to have an updated billing statement. However, in the hospital information system, we have already the balance detection for patients with unsettled accounts. Actually, the accounting department may have this alert feature that may notify the user, both the user is pertaining to the client and the doctors, and enable the doctors to check their patients' balances. And through this daily updates, they could inquire on a daily basis pertaining to the balances of unsettled accounts of clients. This could be also very evident as keeping records for transaction and avoid unsettled balancing, because this may also give an alert if the client have already settled, as well as to the attending physician that the clients have already settled. And the doctor may give uh, any further instructions as well prior to the discharge of the client. The This may also, the balance detection for patients with unsettled accounts may also monitor the patient's financial records prior to readmission, because there are some instances, and as stipulated by law, Clients may not be subject for may not be subject for detention in the hospital because of unsettled accounts. However, there will be a legal arrangement on how the client may settle those accounts. If the client will be readmitted in the hospital, the monitoring can be also tracked if she or he has unsettled accounts. These features, balance detection for patients with unsettled account, obviously uh, has a major function to notify unpaid transactions. This is a typical example of balance detection for patients with unsettled accounts. It will alert patient is with unsettled balance. This is now the indicating the patient's name, the admission date, admission number for tracking, and this is the amount or balance that had been detected once you enter the code for admission number and the patient's name. And with the patient's outstanding balance alert, the client's relative or the clients themselves may receive also this notice. Now, how about inventory stock on hand display? The inventory stock on hand display is a real-time inventory system so that to basically monitor supplies and inventory balance on a real-time basis so that it may alert also the central supply room or the inventory or rather the supply room or the inventory specialist on some situations that sooner or later the stock of a certain drug or supplies will be consumed. So that's why there must be a buffer or there must be a stock that is sufficient according to the operational flow of its utilization. The inventory balance can be evaluated as well of what are the common supplies that are being used and most considered with the regular consumption of it. This may alert the organization to specifically consider these major stocks to take into consideration for purchasing in advance because situations that the hospital may lack or may consider scarce of its resources. This is a typical example of inventory stock on hand display. So we have the patient's name indicating the ID number. And it is not just for organizational purposes. The inventory stock on hand display may also guide the nurses that once you enter a specific item, such as a drug, it may give you the details of the organizational stock, which mainly may alert the central supply room if it is necessary to purchase immediately certain drugs because of the probably number of patients who are utilizing the type of drug. Even with the supplies and equipment, there must be also a buffer. So if, for example, the doctor have ordered a certain drug will be uh, that will consider the time of administration of every 6 hours. So for the whole 24 hours, we may need the stock, the four stocks of the drug so that it could be administered continuously. However, if the stock is only 8, it means that this must alert the inventory specialist or the department that the client will still are projected rather to be hospitalized for the next 5 days. And it may alert the central supply room in the hospital department, even the pharmacy, that the stock is only for 2 days. So the nurse may have the coordination as well through the use of this inventory stock on hand display in connection with the central supply and with the various areas of the hospital. of the hospital as well. Then we have the patient kiosk. The patient kiosk is a touch screen monitor, convenient tool specifically on the aspect that it displays an access of the hospital informations and services such as list of doctors, availability of rooms in the hospital, patients or updated patient statement of account for a faster way of processing transactions. So with the patient's kiosk, the client will be given a peculiar or individual password so that to access this patient's kiosk. And the patient's kiosk uh, may also access the feature that gives an organized list of health benefit providers which allow the patient to track their medical and billing records. So if the client may need, for example, for purposes of processing documents for insurance, if the client may need this tracking documents to specifically submit this to a social work, rather a social uh, work, or rather DSWD or a specific charity organization. So the patient kiosk may have this access upon the the provision of the hospital of giving rights for him to have the access for purposes of such need of requirements. This is a typical example of patient's kiosk. We have the patient ID and the name of the client. You can view your billing statement. So this is a customized kiosk for the client to access basic information about the services of the hospital and for the individual monitoring of the billing. Let us now proceed flexible pricing and discount schemes. The flexible pricing and discount schemes create and design your own pricing discount schemes, giving the advantage of having flexible pricing. These schemes are called as socialized pricing schemes. So what are the socialized pricing schemes? For example, um, we have a regular patient who could be charged with the regular pricing. But for those who are senior citizens, PWD, as according to law, they may have discounts on this pricing scheme, supposedly. So, on this aspect, it could be customized to identify discount schemes for the senior citizens, persons with disabilities, or even with the employees discount as a privilege. So, in short, it can customize this discount scheme as long as they have been identified accordingly to these groups. And this could be very significant so that it may facilitate efficient and effective billing. And with the efficient and effective billing, it may not anymore process the regular pricing the regular pricing uh, computation, and then later on it will just process the discounted uh, computation. So it's automatically when you belong to that group and had been validated accordingly, the pricing itself will be computed accordingly based from the group that you have been identified. And this will be validated by the hospital. Another is the barcode system. So we are familiar with the QR code, we are familiar with biometrics. The barcode system is a useful tool to manage your patients and your inventory at the same time. Usually, the advantage of having this barcode system is to retrieve the patient's profile faster and making transactions easier for the patient and the management. So when we use the barcode system, it may not uh, those access, those barcodes will be given only to those in authority. And when it comes to this aspect, this feature is not limited to patients alone. These codes that will be provided can be used on items, can be used giving to the user an overview of the inventory. So codes are now very important for purposes of confidentiality and security as well. So that's the main purpose. So if you are not given with the barcode, you may not access the basic information that you may need. So it may still have the access rights. Okay? So on the barcode system, let's now proceed with duplicate detection. If we say duplicate detection, when there will be information that will be entered repeatedly, it could be tracked, okay? It could be tracked to prevent its error. Just like it will alert you that the information had been entered already, so that to prevent duplication, because if ever there will be duplication, it may possibly alter the operations, that if there are two names that had been entered of the same information, and once it will process why there are two entries, so it will give already the idea to the individuals who is in charge of the operation of the hospital to prevent such errors. So tracking could be one of the major concerns here on the avoid duplication. So this is a typical example of an alert that similar records found for DOE. John, would you like to proceed? So this is a validation for you to be alert if you will continue the operations and proceed to the platform, or rather um, discard it because to prevent the error or correct the information that had been entered to the original entries. So I think that's all with the hospital information system using the Bitsbox platform. So thank you very much and good day.